Hello, everybody. Today I'm going to talk about a very important topic, and that is menopause. Menopause is something, it's a natural phase in every woman's life. Menopause is inevitable, but the suffering because of menopause should not be there. Let's talk about how we can take care of ourselves during this phase that is menopause. I'm Dr. Vaishali Chaudhary. I'm heading the Department of Fertility and Reproductive Medicine at Mom's Story by Sahyadri Hospital, and I'm also the director of Ankur Fertility Center. I've been in practice for the last 30 years. So let's talk about menopause. When do we say that a woman has gone to menopause? Well, between the age of 45 to 55, most of the times women will experience that their periods are becoming irregular and slowly they are stopping. Sometimes they come after 3 months, sometimes they come after 6 months. So when this period has happened, that almost 12 months, more than 12 months have passed, and you haven't got a period, then you have entered the phase of menopause. Now, before menopause starts, there is a phase that we call as perimenopause. So, anytime after the age of 40, women may feel hormonal changes and a little irregularity in their periods, and so they are going towards menopause, but their periods are still coming. So, hormonal changes are maximum in the perimenopausal phase, and so the mood disorder, the irritability, the hormonal weight gain that happens, all these things are very common even during perimenopause. And what happens once the menopause happens? We must understand that this is happening because the hormones, the women's hormones, that is estrogen and progesterone, that are invariably very important for a woman, are becoming lesser and lesser in the blood circulation. So as your hormones decrease, there are effects that we are seeing on the bones, on the heart, on the skin, on your mood, on your weight gain. So it's basically because the hormones are getting over. And why are the hormones getting over? Because the eggs that were making these hormones are finishing. So the eggs start finishing after the age of 35, 40, like between 40 and 45, they're almost over, and then the changes of menopause can start. A woman can experience this depending upon her genetic history, either at the age of 45 or even at the age of 55. If it happens before the age of 38, 39, we call it premature menopause. Some women may also experience a surgical menopause. That means if they undergo a surgery for which the ovaries get removed, then there may be an early menopause. But of course, all these problems can be taken care of. Now, there are treatments available which are lifestyle management treatments, which you can do just by diet, by exercise, and there are some medical treatments available. So, what are the non hormonal or non medical treatments? First and foremost, you need to change your diet. You need to include stuff that is going to give you more of natural estrogen, like, for example, flax seeds. You can take soya granules, you can take more of proteins, broccoli, for example, green leafy vegetables, and more amount of vitamin D and calcium. So vitamin D capsules need to be taken. Calcium supply in diet foods like paneer, milk, dairy products can give you more of calcium. So you need to include your proteins to make your muscles healthy, and you need to do exercise. So weight bearing exercises are important to build the muscle strength, so that your muscles, your bones do not lose calcium, and your muscles can hold your ligaments and bones together. And lastly, there are some hormonal medications also, but whether you need the hormonal medications will be decided by the doctor, and you can visit them. Your routine pap smear checks, your routine breast examination also become a very important part of menopause management. So as I said, let's not suffer, let's talk about menopause and be healthy. Thank you.